Hey everybody, I hope you're having a great end of spring, start of summer. It's been a while since I've done a video blog, but I am back. Wanted to talk a little bit for physical therapists or even for patients with some of the testing that you might be going through at our clinic. A lot of you will have a therapist that will lay you down and they want to make sure that your left leg can come back and can go down and hit our table. This helps us to indicate that your body's getting in a better position or getting neutral. If you have the ability for your left knee to go down and hit the table with your physical therapist, we always want you to be able to touch your toes. We never want your palms to get to the floor because the muscles in your back, your hamstrings, can be too stretched out. But if you have the ability for your left knee to go down and hit the table, but your hands, your fingers can still not touch your toes, what do you need to work on as a patient? Well, hopefully your physical therapist will have you do stuff to help get your back to open up, to have you squat down, to have you take a breath of air in and hold and open up your back, called your posterior mediastinum, to get that to open up. So I'm going to take a breath of air in, I'm going to exhale, and I'm going to reach. If you still can't touch your toes, with an ability to get your back stretched out, your hip might be a little bit too tight. Your therapist might have you do things to have you get back in your hip to help stretch your hip out, to shift back into your left hip, and to stretch out your hip capsule. If you still can't touch your toes, you might have hip flexors that are too tight, that are still causing your spine to pull forward. So you might need to work on things to turn your hip flexors off. That would be indicated that if you did a test and you came down and your leg could not hit the table, that would be a sign that your hip flexors are too tight and that your physical therapist might need to work on a program to help to inhibit your hip flexors and work your hamstrings and your glutes to extend your hip. Lastly, if you still cannot touch your toes, with first and foremost working on your back, secondly getting your hip capsule stretched out, and thirdly if your hip flexors are okay, then the last thing is you might have to have a physical therapist work up here on what we call your brachial chain. You might have some issues with an inability to be on your discs, or you can have a vision component that's not allowing you to fully be able to touch your toes. This is when working with the PRI trained therapist might help you be able to be in a better position. This is our tip of the week. Have a great one.